Hi there, I hope you're doing great. My name is Dr. Tony Ganem, and along with my partner, Dr. Daniel Buddha, I want to welcome you to rejuvenation, regeneration, the opportunity to come back from painful arthritis and for the first time in history, have less pain, but also be regenerating tissues at the same time. This is a completely natural method of helping people get back to where they were at one time. Now, unless you've been under a rock at some point this year or in a previous year, you might have heard about stem cell therapy. It's all over the news. It is in all the medical journals. The National Institute of Health has been talking about it for some time. It is the future of medicine. And if you're a sports fan, you probably know a lot of your favorite athletes have probably gone to other countries to get stem cell therapy in the past when it wasn't allowable in the United States. Like Kobe Bryant and Rafael Nadal and Peyton Manning and so forth. These people have gone to other countries to get this therapy done because it was a unique up-and-coming therapy to restore their ability to play sports. But the way that I got into stem cell therapy is because of my son. My son had a pitching injury and he was only 10 and a half years old. And because of his age and the location of the injury, which is the elbow right here, you can see that this is a fracture of this little piece of bone right here. The location being near what's called a growth plate. You can see growth plates here where growth is going to happen over time. The last thing they wanted to do was surgery. And at this point, it was basically wait until he's 14 years old to do something about this surgically because it wasn't repairing for an entire year. Well, I'll give you an up-close view here. We actually sought many opinions. We went to the doctors for the Dodgers, the Angels, the Lakers. We went to sports orthopedists, pediatric sports orthopedics. We went to different kinds of specialists to get a clue as to what to do. But because of his age and the uniqueness of his situation, everybody was a little worried about doing surgery. And then stem cell therapy was something I brought up. But again, stem cell therapy is usually being done on people who are older, not necessarily on people who are younger. And so there weren't too many people who were willing to do stem cell therapy on my son. But there were two doctors who were willing to do this. Dr. James Andrews in Florida, who's famous for taking care of football players, quarterbacks, etc., and his partner, Dr. Joshua Hackle, they said if this were my son, I would absolutely do stem cell therapy. And so we actually went to Florida to get this done. And this is us the morning of the surgery. It's 4:30 in the morning. And in his case, it was a procedure that required taking his bone marrow out. That's not necessarily what's done for people today that are past the age of maybe 15 or 20. But for some people, it's the right answer. But in the case of my son, because of his youth and the power of his youthful stem cells, he had a procedure done that took about 30 minutes. And so this was him preparing. I told him, we're not going to let your test not become a testimonial. We're going to make sure that this turns out to be something that we're going to chronicle. So we took some pictures before, and then I just want to let you know how it worked. This is what it looked like before, and 4 months later, this is what it looked like here. Stem cells, which you're going to learn in a moment, are the cells that help you make tissues in your body. They're the building blocks. They're the Legos of your body. Stem cells helped him make new tissue, new elbow, and 4 months later he was whole in the elbow. Now we were very careful about letting him get back into throwing, but almost 1 year later to the date, we actually had him throw a baseball. He was pitching for the first time, and this is him pitching. And I think he struck out 4 people in 2 innings. He did really well in the first time, and obviously he's had no pain since then. Everything has been fantastic. So that's how I got into stem cell therapy, when I was blown away by the ability of the body to repair itself with these stem cells. And it's actually part of your DNA. Your body knows how to repair itself. All the building blocks, all the blueprints of how to build things are in your DNA. And anytime you've ever had a scar, a cut, anything like that, your body has repaired it by way of stem cells. Anytime you've ever broken a bone, a doctor could set it, but the healing that happens by way of stem cells. Stem cells are the building blocks of the body, and you have stem cells in your body today. And this is the power of stem cells. I want to show you how stem cells actually made your body from the beginning. So this is a blastocyst, which is essentially a woman becomes pregnant, and about 2 weeks later, what you developed is called a blastocyst, and this is before it's called a fetus, etc. So this is at the second week, this thing called a blastocyst, which is full of many different cells, and we're going to watch those stem cells turn into a human body. We're going to do this in kind of fast motion, and we're only going to go through the third week and the fourth week of pregnancy and gestation. But I want you to see the power of stem cells. So here we go.
Blastocyst has embedded itself in the uterine wall. It is, in the second week, a disc made up of hundreds of cells getting ready to begin the task of creating individual organs.
And those cells are called stem cells. So now watch what these stem cells are going to do. Now we're going into the third week. These are all stem cells. Watch this.
In the third week, the fundamentals of the human body now begin to take shape, and the camera is privileged witness to the beginnings of the spine.
Okay, so all these little stem cells in the third week of life, in 1 week, are going to form a spinal column. You're going to see a spinal column, a spinal cord, and you're going to see segmentation of the individual vertebra. The entire nervous system is being formed in 1 week by way of these stem cells that are organizing to do this. It's really incredibly powerful. And in the fourth week, what you're about to see, is that the cardiovascular system starts. An entire heart and
a primitive heart
system
forms and begins beating. It is the fourth week.
So now we got the fourth week. Again, the heart is forming. Cardiovascular system is forming. Now, in 1 week, we're seeing systems form from stem cells that are organizing. And so you can see the power of what stem cells are capable of. The more youthful the stem cells, the more powerful they are. But we have some solutions for people who aren't necessarily youthful today, and we're going to show you that in a moment. The power of youthful stem cells being given to people who are not young any longer. You actually have stem cells in your body. They actually line all the blood vessels, preparing for the need to make new bone or new blood vessels or new cartilage or even fat or teeth and even nerves. Your body is prepared to repair things at all times, and so these stem cells hang out at your blood vessels waiting for an opportunity to turn it into different tissues. When your white blood cells encounter damage, they actually call the stem cells to come over by releasing what are called chemicals or cytokines. And these cytokines actually attract the stem cells to come repair this. And so anytime you've ever done damage to your body, even working out, the repair that's done is by way of stem cells making muscles, making new tissue, making new bone when you have osteoporosis, etc., making new hair, making new skin, etc. You'll find even heart in a moment. You'll see some studies that show that actually repairs heart. So what stem cells do is they repair things. They build, they grow, they repair by releasing massive amounts of growth factors. And at the same time, they reduce inflammation. So if you have massive amounts of inflammatory issues, like some autoimmune disease, like lupus, rheumatoid arthritis, or any itis, whether it's gastritis, arthritis, colitis, it doesn't matter. This works very powerful. Stem cells reduce inflammation. But the third piece is that they actually are immunomodulatory. That means that they tell your immune system to not attack you, to take it easy on you and attack foreigners instead. So the three things they do is help you build tissue, calm down pain and inflammation, and tell your immune system to protect you instead of attacking you for people who have autoimmune diseases. Now, who heals faster? The younger person, of course. You get a little cut on this person's face and you'll see how quickly they heal. And you'll see that the person who's a little bit older doesn't heal so quickly. And over time, due to wear and tear and your body's constant usage of stem cells to repair things, you end up with less stem cells, and they're less capable stem cells. And so what happens is your ability to regenerate from damage decreases and degeneration sets in. And so you'll end up with things like arthritis, bone on bone, lots of white on an x-ray, less spacing, that means no cartilage, as opposed to a healthy knee or a healthy back or versus an arthritic back, or a healthy hip versus an arthritic hip. This person doesn't have the ability to regenerate the cartilage. shoulder. This is a healthy shoulder. This is not a healthy shoulder. This is bone on bone right here. So they don't have the ability to regenerate over time. You know, when I was a kid, I could sleep in any posture and wake up without pain. But as an adult, I noticed that it's not as easy for me to wake up in funky positions and have no pain. That's because I have less stem cells now than I did when I was younger. So I have less ability to regenerate and heal than compared to what I did when I was younger. Now, sadly, when people have chronic pain today, if you have arthritis, if you're considering a knee replacement, for example, if you have autoimmune diseases, people who have something breaking down tend to have lots of pain and inflammation. The thing that's breaking down is producing a lot of pain and inflammation. And sadly, the inflammation itself can actually cause more breakdown. So the chemicals that are released through inflammation actually cause more breakdown. And sometimes the chemicals that are released through inflammation actually trigger your immune system to become destructive against you too. So you can see we have multiple vicious cycles here. And what happens is that they ask the question, is it time for surgery? No, we're just barely starting with pain, and so we'll take some pain medications, eventually more powerful pain medications. Do we have inflammation? Okay, we'll take some anti-inflammatories. Do we have an immune system that's attacking us? Well, we'll take some, steroids and potentially later biologics. And then the question is, do we need surgery yet? And that's kind of how it's currently treated today. In fact, there's a kind of a step-by-step approach. Here's the first pain medication you take. Here's, this is kind of step 1, step 2, step 3. And notice that in the process that medicine currently goes through of kind of deciding what medication's next, you even have antidepressants in there. Now, as we get older, we have less and less stem cells. So the day you're born, if somebody were to go into your bone marrow in your pelvis and pull out some bone marrow, you'd find that 1 in 10,000 of the cells that they would pull out would be a stem cell that would regenerate that pelvis. But as you get older, you have less and less stem cells in the pelvis, as an example. So by the time you're around 80, you have 1 in 2 million of the cells is a stem cell. So you can see your ability to heal just from a number of cell perspective has gone down over time. But in addition to that, these stem cells, when you're younger, they replicate themselves every 28 hours. So, 1 stem cell becomes 2, becomes 4, becomes 8, and so forth every 28 hours. And we're not really talking about 1 stem cell. You'll see we're talking about many more than 1. But this expediency at which they replicate is amazing when you're young. But as you get older, it's every 40 hours when you're 50 years old, and it's every 60 or so hours when you're 80 years old. So you can see the numbers going down and their ability to replicate and release chemicals is going down. And so when you take 1 cell and replicate it every 28 hours, then after 30 days, it's 54 million cells. And that's a lot of replication, a lot of growth factor, a lot of healing, a lot of anti-inflammatory effect. But by the time you're 50 years old, it's 1/2 of 1% of what it used to be. And by the time you're 80 years old, it's 0.008% of what it used to be when you were younger. So your ability to heal goes down as you get older. And the question is, wouldn't it be great to have your childhood stem cells back? And until recently, that was an impossible thing. But we're going to actually talk about different kinds of therapies that are now done in the United States, some of them, that can actually help you regenerate some of these tissues through these stem cells. So we're going to talk about fetal embryonic stem cells, amniotic and placental stem cells. We're going to talk about using your own. And we're going to talk about umbilical cord stem cells, umbilical, and Whartons jelly. We'll talk about what Whartons jelly is in a moment here. Let's get into the first one. This is the one that's been in the news. It has a lot of negative connotations associated with it. It is the most powerful one, fetal embryonic stem cell therapy. Although it's the most powerful one, as you can tell when somebody's a fetus, they are making organ systems in a week. Like I just showed you, the nervous system was made in a week, and the heart's made in a week. And so it's incredibly powerful, but this requires abortion. So it's illegal in the United States right now. It's extremely controversial. It has a lot of moral issues. And the embryo is taken before maturity, and you're not just getting stem cells now, you're getting heart cells and liver cells and lung cells and nervous system cells. And so it's not as clean a process. But is it potent? Absolutely. There are other countries in which this is currently being done, but It also has many risks, like cancer is a big risk factor with regards to fetal embryonic stem cell therapy. It's not allowed in the United States, obviously not something we do in our office. The next one is something called amniotic and placental stem cell therapy. Actually, it used to be called stem cell therapy, but now they don't consider the amniotic fluid nor the placenta to have stem cells. They used to say it did, but now they talk about it having what are called exosomes or growth factors. So it contains lots of those growth factors, a lot of chemicals that help healing happen, but there's no cells that are replicating every 28 hours, for example. And so you get kind of a linear dose of these healing chemicals, but you don't get this exponential dose of them. But it also has large amounts of cellular debris, because in addition to some exosomes or growth factors, the baby goes to the bathroom in the placenta. There's a lot of other chemicals that are inside there. It does have some of these what are called HLA proteins, which means that you could react to if you gave somebody placental stem cells, quote unquote stem cells. Now they say that they probably aren't stem cells, but that there are some of these proteins that can make you react to another person's stem or placental or amniotic tissue. It's inconsistent in the concentration of growth factors and stem cells. Again, they can't verify that there are any stem cells in there. And it cannot be given via IV for a person who has some sort of global inflammatory problem. It has its place in therapy, though, because it does have a lot of growth factors. And if they could remove all the cells and just get it down to its growth factors, then again, it can be given as a linear dose of what are called exosomes. Now, autologous bone marrow or stem cell therapy, which means autologous means from your own body. This is what we did on my son. We used his own bone marrow to help him inject it from his pelvis into his elbow to regenerate that elbow tissue. This is a great option for youthful people. It's also an option for people who are not youthful if we want to use the amniotic or placental exosomes that we were talking about earlier. It does require a minor surgery, which is done under local anesthesia in the office. And again, depending on the age, it may not be potent enough by itself. With the exosomes, it does help a little bit. It can be a little more expensive than treatments that could be done through, like, for example, the umbilical cord stem cells that we're going to talk about in a moment. And one of the downsides of it is that it cannot be given through IV unless it is purified, which means it's sent out to a third party who's going to harvest it and purify it and then send it back for a second day, putting it in your body, which can take some time. And essentially, I want to know that my own stem cells would be going into my own body and not necessarily going out to some other lab and being used for other purposes. This is what it looks like when they use the syringe to extract the bone marrow, and in that bone marrow you have some stem cells. And it's a minor procedure that's done in the office, but it does have a little bit of a recovery. It's there's a little bit of an ow factor to it, but it's not a terrible procedure. It's done with local anesthesia, and you're definitely up and about and able to go home and function normally. But it's definitely not as painless as something like the umbilical cord stem cell, which we're going to talk about here in a moment. So umbilical cord stem cell and the jelly that is in the umbilical cord, and basically this is what it looks like right here. This is the umbilical cord, and there are arteries and a vein, and then in the tissue itself there's something called Whartons jelly. So the umbilical cord stem cell therapy and the cells derived from the umbilical cord of a 0-day-old baby, which means it's incredibly potent. It's unique because the umbilical cord isn't just mom's tissue, it's baby's tissue. One of them is not the owner of that. They actually share this tissue. The reason they're both able to tolerate the tissue and not react is because the umbilical cord is a unique tissue in that it doesn't have these proteins, these HLA proteins that would cause a person to react. Uniquely then, umbilical cord stem cells can actually be given to another person and not have a reaction or a rejection like you get with some sort of a transplant. The umbilical cord stem cells are really simple to use, and a procedure can take as little as 10 minutes to do. It's simple, it's fast, and it can actually be given through IV as well and or put in a joint. You give it through IV for people who have autoimmune diseases and global inflammatory issues like lupus, rheumatoid arthritis, lots of autoimmune diseases where we want to tame the entire immune system. It's very potent that way for helping people with those kinds of conditions. But it can also be given to a person who's looking at bone on bone in a knee, for example, or an elbow or a shoulder. It's very customizable and robust. It's consistent in its dosages. It can be really high potency, for example. And it contains both the mesenchymal stem cells, which can be turned into different cartilages and skin, muscle, heart, bone, etc. And it contains CD34 stem cells, which are the ones that could turn into blood vessels to increase blood flow to an area. And it can be given via IV, as we were talking about earlier, for people with systemic or inflammatory issues throughout the body. So again, this is what it looks like. This is an umbilical cord. It has arteries, it has a vein, but it has this Whartons jelly that's really powerful for people who have joint issues. The Whartons jelly has a lot of those mesenchymal stem cells that can turn into different kinds of tissues. Very powerful stuff. So what I did was we graphed out the different types of stem cell therapies and the different questions we had with regards to legality, morality, does it require surgeries, etc. And it became very clear and apparent to us that the umbilical cord and Wharton's stem cell therapies were not only ethical, but powerful and very clean and safe. And you'll see more about how clean and safe they are in just a moment. Now, that does not take away from some of these other ones. Again, the amniotic stem cells or placental stem cells, that's dubious. People say they really don't have stem cells in them, but they actually have a lot of the exosomes, which again have their own application. But it's a case-by-case decision what we make in this office. What is going to be the best way to help the person who's in front of us? Most of the time, it's going to be umbilical or Wharton's jelly in helping people become better. So the umbilical cord or Wharton's jelly is derived exclusively from the umbilical cords of healthy birth babies, not from aborted babies. This is healthy as in mom is screened and baby is screened for viruses and diseases, and only in the case in which a mom says that she's willing to donate the healthy umbilical cord, and only in the case in which that donated umbilical cord is free of viruses, does it go through FDA screening and the American Association of Tissue Bank screening and stored in a third-party FDA lab. So again, this is when moms give birth in the United States today, they're asked if they want to bank the stem cells, the umbilical cord, and save it for a day that the baby might need it. But if they choose not to, the other option is to donate the umbilical cord. And so it's basically donated and screened and stored and filtered down to its stem cells and growth factors for the use of somebody who might need it, like you. And again, because the umbilical cords are immune privileged, meaning the immune system is not reactive, these are incredibly powerful, and they contain massive amounts of potent stem cells without reactivity. And since they are screened for no viruses, you're not putting anything that is harmful into your body, and it's definitely not something that you're going to react to. And what these stem cells will do is, these are stem cells that don't have your DNA, so they will not become your tissue. But these stem cells will live inside your body, and while they're in your body and in the millions and soon billions and trillions, as you'll see in a moment, these stem cells are going to release all kinds of exosomes. These exosomes do things like grow tissues to repair the degeneration, or release these chemicals that modulate the pain and the inflammation, or release these interleukins and growth factors that actually stop the immune system from attacking you. And so as these stem cells are put into your body and as they multiply, they cause the body to multiply your local stem cells at the speed at which they once did when you were more youthful. And they also cause less pain through these different exosomes and less inflammation. And then they cause less immune reactivity against you. So in essence, what used to be a vicious cycle of degeneration causing pain and inflammation causing more degeneration now has a positive vicious cycle of healing causing less pain, less inflammation, less reactivity. And then as these stem cells multiply, because that's what they do. They start to relieve the person of having to take pain medications, anti-inflammatories, steroids and biologics, and even wipe out the need for potential surgery. So again, as these stem cells multiply, and they're going to multiply like they did when they were youthful, they won't become your tissues themselves, but these stem cells are going to multiply every 28 hours, and you're going to see what that turns into, massive numbers. And as they multiply every 28 hours, they release more and more of these exosomes and growth factors that will stop this process and help you get healthier and healthier. So that's how the stem cells work. They actually help your stem cells regenerate faster than they've done in a long time. They release these chemicals that modulate your pain. And unlike steroid therapy, which can modulate pain, this actually builds tissue, where steroid therapy actually breaks down tissue. So this is the first time in history you actually have a therapy that builds tissues and calms down pain at the same time. And what that does is it allows you now to have the power of high regeneration, which stops degeneration. So now you heal faster than you break down, which is exactly what most people want. And that leads to real pain relief, which is exactly what we want. Now, the research currently shows that it can be used for many things: joint pains, back pains, bulging disc, herniated disc, spinal cord injuries, meniscal or ACL or MCL knee tears or hip tears or labral tears, arthritis, tendonitis, different kinds of conditions. But what happens is when you give stem cell therapy to somebody who has these kinds of conditions, it leads to all kinds of other interesting things. Like somebody might say, well, my hair grew better and my eyes are improving. And so currently there are 6,800 clinical trials being conducted worldwide on stem cell therapy and these secondary wonderful things that have happened to people when they get on stem cell therapy. Let me show you some of them. One of them is type 1 diabetes. Stem cell therapy curing potentially type 1 diabetes is something that we're hoping to say one day, but the studies show that there's some hope there. And the studies show that Parkinson's disease from the Harvard Stem Cell Institute actually shows from Harvard University that Parkinson's disease actually there might be some new possibilities there because of stem cells, and that the ability to potentially grow hair is there from UCLA, and you'll see here Alzheimer's disease, and of course you'll talk about dementia as well, and spinal cord injuries and cartilage repair, and I'm just going to keep going here for a little while. We're going to see kidney failure, and we're going to see bowel diseases and periodontal tissues. This is gum and jaw regeneration, and rheumatic or joint disease issues, and psoriatic arthritis, and even multiple sclerosis, which is incredibly powerful to say. And then even the National Institute of Health put something out that actually showed that stem cell therapy can actually heal a damaged heart potentially. And so I'm going to just show you on their website. Towards the bottom here, you'll see an incredible statement that the National Institute of Health made, which actually says that although there is much excitement because researchers now know that adult and embryonic stem cells can repair damaged heart tissue, many questions remain, etc. But the point is that it actually does regenerate heart tissue, and I want you to know that it can actually do that for somebody that you might love as well. So although we can't tell you that we're treating any of those conditions because they're not FDA approved to say those kinds of things just yet, what we can tell you is that there are a lot of people who have improvement in those kinds of conditions, and these as well: vitiligo, scleroderma, arthritis, sarcoidosis, fibromyalgia, myasthenia gravis, vasculitis, chronic fatigue, chronic back pain, erectile dysfunction, Peyronie's disease, lupus, cystitis, Crohn's disease, psoriasis, heart disease, Parkinson's, gastritis, Raynaud's phenomenon, ankylosing spondylitis, Guillain-Barré syndrome, hair loss, dementia, bone density, Alzheimer's, stroke. I'm not sure how it helps with drug addiction, but the research shows that somehow it does. This is Lou Gehrig's disease, type 1 diabetes, and skin conditions, and many more. So stem cell therapy is very, very potent. And truthfully, it's a great option because up till now, people have been choosing to do nothing or take more medication until they need more surgery. But this is the first time in human history we have the option of regenerative medicine, something that not only takes pain away, but actually builds tissue back, which I think is incredible. It's an incredible option. And it's oftentimes less expensive, and it definitely doesn't have as much pain and recovery. I mean, look at the surgery knee replacement here. It could take 3 to 6 months of rehab, and no guarantee of any kind of results. Lots of failures. Many will need a second surgery. It's incredibly costly. Although some people get most of it covered by insurance, even the copay can be more expensive than something that could take 10 minutes in our office to help you get healthier. When it comes to shoulders, it takes a longer time to rehab. It lacks success when there are major tears. Of course, any surgery has a risk for some sort of infection. And even when it comes to these painkillers and anti-inflammatories, people don't realize this, but the FDA says that there are probably 10,000 to 20,000 deaths per year as a result of things like ibuprofen, Celebrex, and Vicodin, and these kinds of medications, and Advils and aspirins, and these what are called non-steroidal anti-inflammatories. And so these aren't the best options either. They cause gastric bleeding and all kinds of digestive problems. Even the cortisone shots that people are taking, people don't realize the side effects of cortisone can be that it causes bone density problems, it can cause cataracts, it can raise your blood sugar and cause diabetes, weight gain, suppresses your immune system. In the process of kind of bringing inflammation down, you now have more risk for infection at the same time. So this has a lot of side effects as well, and it breaks down muscle tissue as well. So essentially what I'm talking about is a natural opportunity to get healthier. And this is an interesting little funny here that says, we've exhausted all the conventional measures. One last desperate option is to put you on an alternative natural medicine that has a 96% success rate. Well, this doesn't have 96%. It's 85 to 90% successful. We can't ever guarantee anything. But what we see is that generally between 4 to 6 weeks after somebody gets a treatment, they come back here saying there's something going on, and we see amazing improvement over time. So I'm going to show you some of that in a moment. It's very safe, effective, it's painless, it's clean, it's natural, it's regenerative, it's powerful, and this is fun to do for people and see their lives change. So I'm going to show you a few testimonials. I'm going to show you first a lady named Rita who had rheumatoid arthritis or has rheumatoid arthritis, and her body is changing. Listen up.
Hi, my name is Rita. I'm from Southern California, 70 years old. I've had rheumatoid arthritis severe for 10 years. And my rheumatologist wanted me to up my dosages because I've been, in the last year, feeling a lot of pain. So I thought, I had to pray. I said, Lord, open a door, guide me. I don't want to take any more medication because of my bone density and because of my eye vision have gotten worse. So my son called me and told me about a seminar that Dr. Gannon and Dr. Buddha were giving. So Paul and I, my husband, came and listened, and we were really interested. So we set up a consultation, and I was really excited because I realized that I was a candidate for this procedure. So we, June 27th, I stopped taking all my medication, all my RA medication, cold turkey stopped. July 5th, I had my injection. Dr. Buddha gave me an IV and 3 cc's of stem cell, which took 10 minutes. The next day, my joints were still swollen, but there was no throbbing pain or the electric pain that you usually get from the RA. As the weeks progressed, I have no swelling in my hands, in my joints, none. The only thing I have right now is maybe swelling here. My grip has gotten stronger. I can open jars, I can open bottles where I couldn't 2.5 months ago. Sometimes when I do have some discomfort, I'll take ibuprofen. That helps. One of the bonuses is my hair is growing. My hair is thicker. My nails are growing. I have more energy. Before I took the stem cells, I would sleep from 10 to 11 every morning, take a 2-hour nap. I was always tired, and now I wake up at 8 o'clock. I have a lot of energy, and I'm really excited because I have grandchildren, and I want to live a long time because I want to see my great-grandchildren. I was at a 10 2.5 months ago as far as pain. I'm at a 5, and I'm not taking any medication, and I'm so excited because I feel normal, you know. Every day is better. Every day I feel better, feel more energy, and I see little things happening in my body, and I call my little stem cells Pac-Man, and I know they're there, you know, getting rid of whatever or a disease that I have in my body.
And for the people who have heard your story, today is what, 3 months?
2.5 months.
2.5 months.
Mm-hmm.
Good job. That's
yes,
fantastic.
I'm excited, and you know, because I had no other recourse. Either take the medication, and that's all I had. So I prayed, Lord, open a door, show me something. And that's when Jeff called and said, you have to go to the seminar. And I really didn't know much about the stem cell, but I was so excited because I was a good candidate for it. You know, what do I have to lose? Nothing.
Nothing.
You know?
But what did you gain?
Oh, I gained life. I gained quality of life.
Now this is Harold and Sharon. They are not the youngest people in the world, but they're doing better. Listen up.
I'm Sharon Stephen.
I'm Harold Stephen.
Now you guys came in here with some pain. Do you want to explain your pain?
I had pain in my lower back,
Okay.
and my side, and on my left side, and my left knee.
Okay.
And Tylenol just wasn't helping, and my doctor didn't want me to take anything more. So I've lived with pain for many, many years.
How many years?
Probably 15.
Right.
And but I've tolerated it. You know, that was my life.
Mm-hmm.
And then I found out about the stem cells.
Wonderful. So we're going to talk about that. That was about how many months ago?
3 months.
3 months ago. Okay, now your turn, sir.
Mine was the lower back, due probably to arthritis.
Okay.
And I had been on oxycodone, hydrocodone. I'm now on tramadol.
Okay, that's different.
Hopefully I will stay on.
Yeah, that's the right answer. So just remind everybody how young you are.
How old?
I'm 95 on the 27th.
95, God bless you. That's
See,
fantastic.
he's 95, but the stem cells that have been put inside of him are 0 days old, and so they cause massive healing as if he were youthful. They cause his own stem cells to multiply at the speed similar to when he was an infant, which is amazing. And what you get are people who have degenerative conditions like this showing up a little bit better just within a 2-month period of time. So the spacing in this knee is definitely better on the right compared to the left. So this is improvement over 2 months. And another example would be after 3 months, this person had absolutely no cartilage. Let me show it to you a little closer. No cartilage at all in there. And now, just a few months later, they have some cartilage in there starting to build up so that they can have some shock absorption and have a regular knee function. This person has a lot less pain than they had before. I'm going to show you another testimonial.
Before we did stem cells, almost 3 months ago, okay, I want you to kind of explain what day-to-day felt like for the knee, and then we want to talk about today.
Okay.
So go ahead.
Okay. I noticed a lot less inflammation along with the weight loss, but I was still struggling, and I really thought that I was going to have the surgery for knee replacement. I really felt inclined that way. I actually made an appointment to have the knee surgery. Went through all the testing and everything else. And then I was, Dr. Tony mentioned about the stem cell, and I prayed about that, and then I went for it. It took about 7 to 10 days, and then I started feeling something. I can't even say what it was, just something. And as time went on, the something feeling started to grow. Amazing. I can't say what's happening exactly. I mostly have all good days, but once in a while I have a day where, you know, it's not so good, but I think that's to be expected because it's still working.
Hey, remember, we're only halfway done here.
I know! That's what's thrilling!
Yeah, and most people don't feel the stem cells working until about 4 to 6 weeks.
Wow, it's amazing how I really felt it right from the get-go, and more and more and more all the time.
Yeah.
So I can't, you know, measure it like, oh, today I feel more than I did yesterday, but all of a sudden it's like, wow,
Yeah.
I'm feeling something. I know something's growing in there. I know something's changing in there.
So how does that change your day to day?
It changes my day to day because it first of all, I can do things quicker. I can do things that I never did before.
Like what?
I can go up and down stairs, which I was struggling to do that. I either needed help holding on. I could never carry anything. Now I can carry a purse and a bag and still get up the stairs. I was struggling with balance, with staying on my feet. I was falling. So now I don't fall anymore. I even do, when I go to physical therapy, I do these ladder things where I'm almost dancing. They put the twist on for me because they said, "What kind of music do you like, Jeanette?" And I said the twist. But the ability to get up and do everything, it's just amazing.
It's remarkable to hear that somebody who had scheduled a knee replacement.
Oh, I canceled that a long time ago, and they even called me up and said, "Would you like to schedule now?" I said, "No, ma'am."
Awesome. Congratulations.
Thank
you deserve everything
Thank
that you have received. It is so fun to help people smile like that, to get their life back. You know, she's feeling youthful. She started feeling it within 7 days, and from time to time we have people feel it a lot quicker, but generally it's 4 to 6 weeks, but pretty consistently, over about 85 to 90% of the time, we're seeing this kind of response. People just getting healthier and feeling amazing. So what I want to do right now is go over some frequently asked questions. I want to do unto you as I'd want done unto me. If somebody were presenting something to me, I'd want them to answer my questions. And since we're not doing this live, I wanted to put forth to you some of the answers to some of the most frequently asked questions. So let's do that. The first one that people ask me is, are stem cells FDA approved? Well, the answer is that the approval process from the FDA is only for drugs and for medical devices. So the FDA doesn't have an approval process, they have a clearance process. So stem cells are called FDA cleared and regulated, as opposed to approved, which is, again, reserved for medications and medical devices. But that said, they're definitely being observed by the FDA. It's not something that's not observed. So, for example, a blood transfusion is not FDA approved. It's something that is cleared by the FDA because a blood transfusion is tissue. It's not something that's a drug or a medical device. So similar to that, the guidelines of the FDA are used in the process of banking it and storing it and using this, and it's cleared and regulated by the FDA. Is umbilical cord tissue or Whartons jelly safe? The answer is absolutely. The cells are rigorously tested and screened under the guidelines of the National Institute of Health, the Food and Drug Association, the FDA, the American Association of Tissue Banks, and the American Association of Blood Bank guidelines. So essentially, it goes through multiple governmental guidelines, a lot of red tape and clearance. The labs have to follow procedures, the doctors have to follow procedures, and because these are less mature than any other cell, and because these don't have the HLA proteins that we talked about earlier, the body doesn't recognize them as foreign and allows them to be used without reaction. Let's see, the next question is, does insurance cover stem cell therapy and its procedures? The short answer is no. It's not the usual and the customary treatment for painful conditions and for conditions that might require surgery. And because it's not the usual and customary, because drugs and surgeries are the usual and customary, they are not covered by insurances and Medicare. But what people don't know is that the Medicare and insurance companies follow the guidelines of Medicare. For example, Medicare Section 2251.3, the Medicare guideline, says that any treatment plan that seeks to prevent disease or promote health or prolong and enhance the quality of life, or therapy that's performed to maintain or prevent deterioration of a chronic condition, is not medically necessary. So the chances of this becoming medically necessary and something that insurance or Medicare would pay is probably pretty rare, because this is enhancing health. Similar to making choices like plastic surgery or other things that would just enhance you, the insurance companies say this one is on you. We don't pay for this. We pay for pain reduction with medications. We pay for surgeries. Okay, but that said, it can often still cost less than most surgical copays.
or the cost of an ER visit, which can be in the thousands of dollars, or some medicines or rest homes or insurance deductibles or more. A lot of people ask, do you treat my disease? We don't treat disease. We actually use stem cells to promote health, and the health overcomes the disease. And so we keep ourselves really clean here by not treating disease. We actually help people build up their body's ability to overcome different maladies that are going inside your body. It's a philosophical thing, but it's my belief that the body is what heals itself, and the power that made the body is the big healer. Is there anyone that cannot be treated with stem cells? Well, people with active cancer, not people in remission, but people who have active cancer cannot be treated with IV stem cell therapy. They can maybe have a joint injection, but they cannot have IV stem cell therapy. People who are pregnant should not have stem cell therapy, but the reality is they probably got trillions of stem cells going through their body, so they definitely don't need stem cell therapy. In fact, that's what gives a woman that glow, and her skin is improving in her hair. It's the stem cells inside of her. And also people with active blood infections. How long does the treatment take? Generally 10 minutes to 20 minutes. Unless you do an IV treatment, that can take a little longer to set up the IV, but maybe 30, 40 minutes at that point. How many treatments does a person generally need? The answer is generally one. Now, if a person has a knee issue or hip issue, it's generally one. If a person has an autoimmune disease, it could be more than one, but I like to use the time in which you're healing to go and find the trigger of the autoimmune condition, so that once the stem cell function decreases over time, because stem cells do die over time like every other cell in the body, we don't want your immune system to start being activated and start attacking you again. So we want to find its trigger while you're healing, so we can make sure that when you're done, when these stem cells do die off, that your body doesn't reactivate the condition. So we use the time period when you're getting better to go look for the condition, the cause. So generally, the stem cells benefit in your body for up to 6 months. That's what they do. For 6 months, they exist in your body, but because they don't have your DNA, your body doesn't graft them into your tissues, so they have an expiration date on them. And so over the 6-month period, they heal things. That doesn't mean that when 6 months are done, they go away and all your problems go back to where they were. It actually means that any health or any growth that has happened in that time might actually provide all the pain relief you need going forward. That any cartilage you've rebuilt will make you feel great going forward, even after the stem cells themselves have died. They reproduce every 28 hours. They live for about 90 days each, and the second generation of cells live 90 more days. So essentially they reproduce for 65 generations, and they stay in your body for up to 6 months. How long would it take to notice a difference? This is one of my favorite things to show people. So I show this graphic. Look, if we were to just do one injection into a knee, in day one, let's say we put 1 million stem cells inside the knee. By day 2, or I should say in 28 hours later, just a little more than a day, you would still have those 1 million, but now you'd actually have them duplicated. So now you have 2 million stem cells. And 28 hours later, you'd have a doubling of that, and so forth, right? A doubling and a doubling. Well, they will double for 65 generations and stay in the body for 90 days. So this doubling and doubling and doubling and doubling and doubling will get you a massive dose of stem cells that will stay in your body. And they'll definitely reach a peak of stem cells and growth factors and anti-inflammatories around the 90th day. And then on the 91st day, the first generation of stem cells will have died off. And on the next day, the second generation will have died off, until you get to the place where, 180 days later, you're getting the last generation of stem cells. But essentially, somewhere around the 4th week or the 6th week, when you have trillions of cells because of this multiplication, this is when people start saying, wow, I'm feeling something going on. It's very nondescript, but they say, I'm feeling a difference. And that's what I love to hear, is in general, when I first meet up with a person after the treatment, about 4 weeks later, how are you feeling? And this is generally when they say, I can feel something happening. I don't know what it is, but I feel something happening.
And then around the 90th day is when they feel the massive dose of things that are happening. And that's fun to see people's lives feeling different at that point, so they function more. But the best part of it is when you get to this place and they're still feeling fantastic, I even smile more, because that means that's permanent. Anything that happens after this, when all the stem cells are gone, is because you've built new tissue. And now with more cartilage and more meniscus, you feel better because you've done something fantastic to change your life. Are there any potential side effects to the stem cells? An injection is an injection. Some people say ouch, but most people don't. They say that 2% or fewer experience flu-like symptoms when you do an IV therapy, although I've never seen somebody have a flu-like symptom after the IV. It is a possibility. We ask people to limit activity briefly after therapy. So if you're a runner, we would ask you to kind of walk instead of run. If you're an athlete, we'd ask you to kind of cut it down a little bit. But we wouldn't want you to cut it out completely, which is unique. This isn't a surgery. We actually want you to do some inflaming of the area, not massively, but remember, inflammation calls white blood cells to come to the area, and the white blood cells call the stem cells to come over and fix things. So we want a little bit of inflammation in that area. And actually, we ask people not to take anti-inflammatories during this time. So again, inflammation is incredibly important. If you've ever had a reaction to a chemical called DMSO, we'll ask you to take Benadryl so that you don't have a reaction within the therapy. DMSO is an agent that helps disperse the stem cells. And so we actually do a little test in the office to make sure that you don't have a reaction to DMSO. How fast will I see results? Well, everybody's different, but 4 to 6 weeks is general. Some people sense it a little faster, rarely a little bit longer, but generally 4 to 6 weeks is when people start telling us that they're feeling something. Remember, this is not just an anti-inflammatory, although it has a lot of anti-inflammatories that are exponentially growing inside you. This is a building process. So as you build tissue, you feel better. So it takes a little bit of time. How much will it cost? Well, I don't know exactly what's going on with you, but after we meet with you and understand your needs, and will it need to be done through IV and how many joints, etc., that's when we'll have a sense of what's best for you and what it'll cost. And that's when I'll be able to give you a more clear answer. But here's what I can tell you, is that if we were to do, let's say, one joint, let's say a knee or a hip, and we were to use the umbilical cord stem cells, then 1 cc of stem cells, which is enough to treat that joint, would cost somewhere between $4,900 if financed over 12 to 78 months, or if paid up front, $4,600. That's generally less than a lot of surgical co-pays, definitely less than a lot of hospital room stays for one day. It's less than the last time I went to emergency care for kidney stones. It was more expensive than this. So this is a fantastic procedure, and it's not as costly as people think it is. And we can finance it over up to 78 months. We use Care Credit and Green Sky financing, and you can actually get the pre-approval for the Green Sky even before you come in, so we could see if you're approved for it. Now, the distributor of the stem cells gives us a discount on a person who needs a second CC, because they're already pulling from the first umbilical cord, and they want to always make sure they're using the same umbilical cord for the same person. If they have to take 2 cc's from the same umbilical cord, it saves them a little bit of labor, and so they give a discount on the second one. If you needed to go to a third one, the third one would be 20% off, and that's their discount to us, and so we pass that on to you. This is not us trying to make a deal for you. We're trying to help you by passing along this discount. Essentially what I do with people is to understand what's going on with them first, so that we can meet with you and take x-rays if necessary, look at your past records, and make a great decision for you. And if it's a go, we schedule the procedure as quickly as 2 days later. So a 30-minute evaluation in our office, which generally costs $297, we give you the opportunity to do it for $97. So we take off $200. This is usually a seminar special, but we're making it a webinar special for those of you who are watching this online as well. If you contact us and pay the $97 for the evaluation, we will meet with you and do the x-rays. One thing I neglected to say is that treatment price that I showed you includes 6 follow-up visits once a month, It includes prescriptions for physical therapy and medication if necessary. If you have a type of insurance like Medicare or HMO that doesn't allow an outside doctor to prescribe the physical therapy, we do the therapeutics in the office ourselves. We are located in Costa Mesa and Santa Ana, right on the border, and we're looking at expanding as well. And so essentially what I'm going to ask you to do is, if you haven't already done so, please call 714-210-2827 and speak with one of the gals, one of the front desk gals, to schedule your evaluation if you haven't already done so. And I look forward to seeing you at your evaluation. Take care. God bless.